structural determinants of health through cross-sectoral collaborations. Part of that is thinking about food resources and nutrition assistance. So I just thought I'd throw that information in there in case you weren't aware of this entity yet. Okay, so to get started, I think the reason why most of you are here, and thank you for sharing kind of existing work, including kind of your Danielle from Reedley, kind of the importance of incorporating researchers, scholars, and practitioners from this region. So I'm actually from Los Angeles and from northern Mexico, not from the San Joaquin Valley originally, but part of my interest and part of the draw on coming here is I've been interested in food insecurity and obesity and the linkages between food insecurity and obesity and diet for Latinas. That was part of my dissertation. And when I became aware of the disparities here in this region and kind of this added complexity that a lot of the people here are part of the agricultural process and part of food production, but then they also suffer from really some of the highest rates of food insecurity and obesity. That was a really, I don't want to say interesting, but it really drew my attention because they were part of the food production process, but excluded from the benefits. So that was part of the draw in coming to this region. And the last 3 years now, I've really focused on taking an asset-focused approach to learning about community-based organizations that are doing work here, connecting with different partners, and building from the ground up before I've kind of, I've started on this topic. And this year has been particularly important. It's been a really important segue to building these collaborations and carrying out some of this work. So just broadly, for those who are less familiar with the San Joaquin Valley, the San Joaquin Valley region is predominantly low income and rural. It encompasses 8 counties. So that's Fresno, Kern, San Joaquin, Stanislaus, Tulare, Merced, Kings, and Madera. And there's over 4.3 million people located in this region. And all of those counties have some rural areas within them. They may not be counties that are designated as rural, with a few exceptions, but all of these counties do have rural components to them. And then there are really high food insecurity and obesity rates here in the region. And so, before COVID-19, some of the food insecurity rates in this region, about 40% of the population overall was food insecure. And the food insecurity rates, there's this gender dynamic where women have higher rates of food insecurity, which I think you probably all know. So we'll kind of gloss over that and come back to that. There's also a high percentage of Latino immigrants who reside here, and a high percentage of them, about a third, live below the federal poverty line. And then a lot of the other issues that come with being in rural areas: limited economic opportunities, limited access to transportation, healthy food, healthcare services, and information, are really similar. Those kind of rural issues are very prevalent here and can be complicated by language access issues. So we also have a variety of linguistic needs. In addition to Spanish, we have indigenous populations. We have diverse Asian populations as well, especially Hmong populations. So the language access needs are also really, I just want to highlight that as something that's important here in the region. And the pandemic has really, I think, as everyone knows here, has exacerbated existing health disparities and food inequities. And on the economic component, really the major drivers are job and income loss. Individuals being put in these positions to choose between safety and their paycheck. And then employers that are not providing PPE. So families being forced to pay out of pocket for some of these costs. And so these are some of the things you've heard about in the media, but it really drove a group of us to become interested in formally studying this very early on. And then the last piece, these new expenses that have arisen. So a new basic need, which is broadband internet access for remote education, for healthcare services, and also now to access food in different ways or information about food. And then some basic needs, there's been food price fluctuations, especially early on. And the added childcare responsibilities with school closure. So in the early months, a couple of colleagues and I just became really kind of, talking about this. We were meeting remotely, and there are a few opportunities for different grant proposals. And so I'll talk about 2 of the studies. The first being collaboration with Marilena Young at UC Merced, who is a health policy researcher who is an expert on immigration policy exclusions. And then we're also, I'm one of the co-investigators of this study, and Cedra Goldman-Mellor, who's a psychiatric epidemiologist, is the other co-investigator. And so we wrote this grant proposal in response to the UCOP emergency COVID-19 seed funding, and received funding for a study on the impact on Latino immigrants in rural California. And we were really interested, we wrote this in actually March and April. We were really interested in this piece of immigrants' exclusions from policy responses to COVID-19, but also more broadly, Latino immigrants' responses to social and economic constraints that arose during the pandemic. And this is just a picture of our study team. Marilena's in the middle, and then this is Cedra Goldman-Mellor. And then we have this fantastic graduate student researcher who's in her first year in the PhD program at UC Merced, Fabiola. And then we have Hannah, who's an excellent undergrad RA. So we have called ourselves this scrappy team who's been doing, we did this work over the summer. And so, you know, when we started right off the bat, and you know, these have been remote interviews, and I'm just going to provide and spend more time on this study because we've actually finished the first part of this study, and kind of give you a sense of the next steps. And then I'll talk about very briefly about this second study that focuses on food pantries. So to keep going, so this was one of the things early on, Marielena and I were really interested in the policies that came out at the federal level in March. There are various policies, including the CARES Act. You know, there's this piece where, in this case, undocumented immigrants were excluded from some of the policy benefits, from stimulus money, but also that impacted mixed status families. And so kind of thinking about how significant of an exclusion this was. So given the restrictions of policy exclusions that were explicit, about 15.4 million people in mixed status families were excluded from stimulus payments this year. And this gives you a little bit of the breakdown and the difference. So it was close to 10 million unauthorized immigrants, close to 4 million children who are US citizens or green card holders, but because they were in a mixed status household with a parent who was an unauthorized immigrant, they did not receive the stimulus money. And then close to 2 million spouses who are US citizens or green card holders. And so due to this, actually, if you're only focusing on the individuals who, you know, quote unquote, had a right to benefiting from stimulus payments, that's close to, you know, 5.5 million US citizens and green card holders who were excluded from this relief because of the composition of their household. And, you know, we're one of the states, we are the state with the highest number of individuals who were ineligible for pandemic stimulus checks. And so what we came up with, and I have, I'm really committed to community engaged research, and a lot of my work on interventions has focused on a community engaged research approach, whether that's community-based participatory research, being fully in, or more, you know, just engaging with community members in a smaller dose throughout the study. And so one of the things that I added to the approach was thinking about a community engaged, but a rapid community engaged research approach. So we received the funding, and right away I recommended we have an advisory board, but knowing that a lot of the potential members might be overwhelmed with the work that they were doing on the ground. And so we were really we wanted to be guided by practitioners and advocates working in rural communities to also kind of verify the results as they came in, and to also guide us in terms of the dissemination product. So early on, we were able to put together an advisory board and invite different organizations located here, but also the organizations that have impact on state and federal policy. And we started off with 4, but it actually grew really quickly. You know, through advocacy networks, they invited others, and they were really interested and wanted to be engaged and contribute to research. And so this is a current composition of our board. We have the Pan Valley Institute, Faith in the Valley, El Comité del Valle, Californians for Pesticide Reform, ACLU, the California chapter, California Immigrant Policy Center, Farm Worker Justice, Unidos US, formerly the Council of La Raza, and then this new organization at UC Merced, the UC Merced Community and Labor Center, that just launched this year during the pandemic. And so this advisory board we've met 3 times over the course of 6 months that this project has been underway, and they've been a really critical component. We've also solicited ad hoc advice from different members at different stages. So part of it is just to highlight that we have been able to do and continue with community engaged research under remote circumstances. And actually, there's a lot of organizations that are interested in participating in research during a crisis, but having clear asks has been very important. How many times they'll be participating and what their role will be. And so I think that was really helpful that we provided that from the beginning. And so as of now, we've conducted 21 interviews. So it's a qualitative research approach with immigrants in Merced, Tulare, and Imperial counties. And so these counties were actually selected by our advisory board. We presented counties that had really high COVID infection rates and outbreaks. Actually, those were kind of the 2 criteria that we were thinking about, and high percentages of Latino immigrants who were living in poverty. And then the advisory board gave us feedback on specific counties. And so we were originally really interested in focusing on the San Joaquin Valley, and someone who was not from Imperial County during, this was over the summer, when there's a lot of attention about the border and what was happening in Imperial County, mentioned Imperial County, and a lot of the advisory board members just said, we really want Imperial County to be included, and they did meet the inclusion criteria, so we added them. And so these interviews were conducted by our graduate student researcher. They were conducted over the phone, and the recruitment approach was either through our advisory board members or contacts in these different counties. County social service offices or health service contacts that we had. So it was a convenience sampling approach. And then, as part of this is listening to Latino immigrants to hear their key needs and experiences during the pandemic. And we had specific areas that we were interested in to develop the script. So I was really interested in nutrition and food insecurity broadly. The main theme was really thinking about social and economic changes and awareness and responses to policy changes. And then Dr. Goldman Miller added pieces about mental health. And then we had a brief survey where I included the short form from the food insecurity short form. So we have some quantitative data, but it is a small sample. And then we have questions around, validated questions around depression as well for the purpose of using that in our analysis. And so throughout this process, we're also really committed to upholding standards of scientific rigor for qualitative research, even though it's a rapid data collection process. And we have a community engaged piece, but that has been at the crux of this process. And then the one dissemination product we had in the grant proposal was a research brief. And so part of that is seeking to build this bridge between research, advocacy, and policy. The goal being that if our findings could inform policy and be really useful during this time in a timely fashion. And so our first product has come out. I have a link here. It's our research brief. And the topic was actually selected. We presented some of the findings to our advisory board, and we let them select the topic that they were interested in the most. And I, as a researcher who focused on food insecurity, I was really hoping for food insecurity, but the advisory board went with the broad financial impacts. And so we ended up writing this research brief in response to that, and it came out in October. It's just a couple pages long, so you can see the link at the bottom. It's available for your interest. And I'll just highlight some of the broad findings, and I'll focus on the food insecurity piece, what we found. So we kind of did like the quick analysis for this brief, but now we're engaging in the full coding of the interviews. And this was actually one of the products that came out. We spent some time putting together this diagram on these different pieces and domains that are impacting financial insecurity for this group. So kind of the broad buckets are workplace protections, job loss, increased living costs, and the need for broadband internet are contributing to financial insecurity for Latino immigrants. And at the top, you see this really stark quote that comes from a participant in Tulare County, where this individual said, right now we either die of hunger or die of the virus. And to provide some context, at that time, this individual shared that several people in their community had been infected through it was an employer-based infection of COVID-19. And that individual and their family were also facing really high food insecurity issues. And so we elected to include that because it highlights these kind of the two pieces of infection, but also this hunger issue that has arisen during the pandemic. And so we just wanted to kind of, through this visual that we develop, what you see in between are actually what some of these pieces are. So the increased living costs include, and I'll just highlight, increased cost of foods. So some of these increased costs of foods, especially for families, because the schools are closed, and so because the interviews were over the summer, there were some people who were able to access during the year alternative forms of school meals during the pandemic, but then over the summer, a lot of the participants just didn't know where they could get food, if schools continued that or not. And so they were basically providing meals that they were not used to providing if their child was in a school program over the summer or a summer program that had been available. And so there's this increased cost of foods because more people are at home as well. And then the other pieces were just higher utility bills. I'll just highlight the heat. So paying for air conditioning, paying for alternatives to air conditioning, paying for increased use of, as we all are during the pandemic. So having costs that were usually covered by your workplace or by a school, no longer that no longer being an option, having to pay for that over the working remotely or being at home. And so that was another big issue contributing to financial insecurity. And then the broad kind of issues we found, they're really, what you're hearing is this job loss, really high levels of job loss or income loss or working less time. But some of the other kinds of issues were just not having protections at work or not having PPE provided or information provided in the workplace. Particularly, we have a number of farm workers included in the sample and individuals from meat packing companies. And so meat processing companies, and that being an issue that was shared, that they weren't given information or protections about COVID-19. And this contributed to increased costs. People were paying out of pocket to buy PPE for themselves, including face coverings. And so I invite you to read the research brief with more detail if you're interested in some of these other pieces. But I just have one slide that highlights this financial instability and food insecurity issue, which we're just starting to explore in more detail. And so Latino immigrants, they're facing food insecurity and barriers to accessing nutritious meals due to financial constraints, which is not a big surprise. We're confirming something that I think the media has been reporting. You all know through different work that you're doing or communities you're connected with. And one of the piece we're kind of high, but we really wanted to elevate this piece, what these specific issues are. And so I just included a quote here from a participant who, with the suit, this is not her name. We're just trying to limit ourselves in what we can eat, even if it was beans every day. And so the participants, we do have questions asking them for changes in the acquisition of food, so food procurement, and then what's provided at the household, so food purchasing early in the pandemic. And so, one of the major changes that people are mentioning is like reducing what they have to deal with food insecurity. And then there's this also piece of changes in, the proportion of staples. So shifting, beans were part of your diet. Now there's a higher, they're more of a frequent part of your diet, and other things are being reduced. So we also have found comments, particularly when meat prices went up, that was reflected individuals not purchasing meat or reducing their meat consumption, which can be a good thing, but not if it's not your choice, right? Or not preferred. And so these are the things that we're just starting to dive into and look at closely. And so some of the other things something else that came up with was actually focused on the community organizations that are available for food assistance and nutrition assistance. And so one of the things we found as it intersected with this other need, so the lack of PPE for personal use, actually what we found is that charitable and community assistance programs that were accessed for food, emergency food services and nutrition assistance, they were also being accessed for PPE donations, and were providing this. And so kind of the dual demand of not only food, and I'll talk about that shortly, but also these organizations have been strained because they are a life source for individuals for PPE that's not being provided by other sources like the workplace. And so this was something that came up as well for several individuals. So food banks and churches serving kind of this purpose of information for COVID-19 guidelines, as well as face coverings and other sources, other resources to protect against infection. And we also have some information on school meal programs, but actually a lot of the individuals were not aware of, for example, pandemic EBT. Only one participant to date has mentioned pandemic EBT and their participation. And so some of the policy recommendations we included in the brief, they really do focus on the social determinants of health during the pandemic, the thinking being that that can help address food insecurity issues. So we have, these are just broad buckets without so much detail, which the research brief has more detailed policy recommendations, but providing income support at the state level, regardless of legal status, supporting employment security measures and enforcing OSHA regulations and employee safety being really critical, ensuring basic needs are met by protecting housing, utilities, and food access. So these three pieces being connected to the financial insecurity of Latino immigrants. And then this piece is improving outreach efforts, communication, and enrollment in federal nutrition assistance programs such as CalFresh. And we do have some enrollment data. We also asked about their enrollment and participation in different programs. We just haven't, I didn't get that for today. And we're actually also collecting some information around other barriers, so immigration policy barriers to participating in these programs. And then lastly, expanding access to free broadband and PPE and expanding access to telemental health services. So because of Cidra's involvement, she's really interested in mental health services, and that's something that we were actually, we've collected quite a bit of data focused on the mental health impact of Latino immigrants. And I'll just highlight that that's actually been really key. Latino immigrants actually have had some of the highest rates of any group actually at the national level of increased rates of depression, suicidality, and other indicators of psychological distress during the pandemic. And so some of the things these policy recommendations really came from our advisory group, as well as the findings, the preliminary findings from the study. And we are very much trying to think about, policy in the early legislative cycle, thinking about, if there's a new form of disaster relief assistance from immigrants, no one in our sample, it's a very small sample still, but no one in the sample actually received the disaster relief assistance for immigrants that was provided at the state level. And what we heard, actually, a big barrier was people were spending a lot of time trying to call and access information. And some people spent weeks until the money ran out. And so that was actually a big issue. And what we're hearing from individuals was that if you were connected to the right organization or the right people, you would get it. But if you weren't, then you would just spend a lot of time, including in one case, a woman who had her children, they were all calling on the phone from 8 to 5 for multiple days without getting information about this, and didn't end up benefiting from the disaster relief assistance, which ran out very quickly. So this was, in some cases, some of these programs were actually very difficult to access and costly in terms of time. So our next steps are to complete the qualitative data analysis with a focus on the key themes, including food insecurity and mental health. But we actually did recently obtain an additional round of funding. So we're going to continue and conduct a second wave of data collection that starts now next month. And we're going to include 2 additional counties, one in the San Joaquin Valley, and then potentially another one in the Central Valley. But we're also thinking about maybe we're going to let our advisory group decide the second county. And then we really want to dig deeper into specific topics. So we just spent a couple of weeks expanding the interview guide on some topics. And so one of the things that I've expanded our interview script on is thinking about these interrelated issues of food insecurity and obesity during the pandemic. So we don't have a lot of questions around weight gain or weight changes, or even more detailed diet questions. And so one of the issues I think most of you are very familiar with and actually have contributed to the work around this relationship or syndemic between food insecurity and obesity, particularly among Latina immigrants. And so some of the things we're going to study more closely are the impact of pandemic-related stressors, and their role in reducing food availability increased psychological distress among Latina immigrants, particularly mothers. The role of structural and interpersonal barriers on food access, and exploring this impact of psychological distress on this association between food insecurity and obesity during this period. And so our questions, we have more probes and more detailed questions that really do target, and we aim to collect how these dietary behavior changes are related to food insecurity and the availability of food, but also in interpersonal relationships and additional distress or anxiety or other forms of psychological distress that people are experiencing at higher rates during this time. So we're hoping to make it more nuanced for the purpose of understanding what has happened during this time in this area. So I'll actually stop for a second because I'm going to move on to the next study, which is much briefer because we haven't done as much. Are there questions about this first study?
I have a question. Thank you so much for this presentation, and it's timely to be listening to this now because I just saw an article today that was specifically about farm workers in California and the lack of, so I think, and you probably would know better than me, that there's, a statewide, 2-week paid sick leave if you get sick, but it sounded based on this article that wasn't being communicated. So I really liked your policy steps, but I'm really curious about enforcement and how do we get that policy to be enforced? Because I feel like there's this tension between companies wanting to get their product out on the market and the health of their employees. It seems to be just an overarching theme of this pandemic, and I could see that tension specifically with this community. So I'm just wondering what your thoughts are.
Sure. I mean, that's a whole nother, I feel like I'll be very brief in my responses because I could spend an hour talking about that specific issue. Because California actually hasn't done what Oregon did in terms of their statewide OSHA that aimed to protect farm workers specifically as part of the essential service line, including protections in housing and separation between households, changes in how spaced out they are in their workplace, and the provision of PPE. And California has not done that up to this date. A couple weeks ago, they came out with better OSHA protections for the first time, but they still have not explicitly focused on farm workers and the agricultural process. And the federal level, and they've really been lacking during the pandemic in actually providing clear enforceable guidelines and even reporting guidelines. So one of the things that we're finding from the farm workers who are included in the study is this fear of retaliation. So yes, lack of awareness of what their protections are and the availability of paid sick leave, or even COVID-19 specific guidelines that came out as part of the federal level policies in March, not knowing about them or if they applied to them, and then in their own workplace, not knowing who to ask. And for farm workers, really, it's less so the farm versus the farm workers. For those who study kind of these relationships, it's the mayordomo or the supervisor who's this mediator. And that's actually the key person that a lot of these farm workers have access to. And in many cases, that was an individual who was a farm worker and then was promoted. And it's a very interesting and challenging situation, but that's the person who's giving them information about changes, policy changes. And that's in some cases the person who says you shouldn't report this because then they're going to fire you, and promoting kind of retaliation or fear of retaliation. And so those are some of the labor relationships and challenges within the existing structure. And because farm workers have been deemed essential, and then their existing lack of protections in the labor market, these things have really come into play where, the people who are farm workers and the people who have family members or have friends who are farm workers are not taking advantage of, because of lack of awareness or fear of retaliation, these protections, even if they have symptoms, actually. Did that answer your question? It is. We've had a couple of really heartbreaking moments, particularly our GSR, who's been conducting the interviews. Okay, so I'll present, the next part is really brief. I'm going to move to food pantries, but we can always come back to this study at the end. And so one of my graduate students, Kim Sanchez, she's a 2020 CARE UC Innovation Fellow. And so she presented this proposal in January before the pandemic, and then was accepted to this program, but she had to adapt. And so we originally planned was for her to go to the border, the California-Mexico border, and study issues of food insecurity and the provision of emergency food services along the border and nutrition education. And then she's been very responsive and adaptable, so rapidly shifted because of COVID-19 to focus on instead the nutrition environment of food pantries in the San Joaquin Valley during the pandemic. And so I think people are very familiar with this food insecurity issue. Many more people who have never been food insecure are now food insecure because of the economic crisis. But they're also, thinking more regionally, the San Joaquin Valley counties, the explosion in demand, but also people who are part of the agricultural process, but also really being excluded from the benefits of assistance programs. And so I won't get into all of the nuances, but this really does focus on the nutrition environment of food pantries, and thinking about it has some methodological implications as well for data collection. And so knowing that food pantries, just in general, this being a really important question, with the food environment of food pantries, charitable food programs can serve as really critical local resources to alleviate hunger, but a really high percentage of them provide food with limited nutritional value, and they can potentially contribute to malnutrition. And because dietary intake among food pantry clients who are food insecure may be worse, there's a couple studies that support that, than food secure clients, improvements in the quality of food options offered by these sources are needed to avert unintended widening of disparities. And that was the case before the pandemic. And so one of the things we were interested in studying is the nutrition environment of food pantries, but then food pantries have also been forced to shift because of COVID-19 guidelines, the way that they distribute food. And so we also are pilot testing this adapted version of validated nutrition environment assessment tool that captures some of this emergency distribution, these modalities that have shifted during the crisis. The goal being that this is actually really important for crises in general, not only the pandemic, but future pandemics, other disasters, et cetera. And so we are trying to see if we can adapt this and maybe validate it in the next year. But for now, just collect data around, different distribution models during a crisis. And so our sample are food pantries in the San Joaquin Valley, and currently she has been able to collect data from 7 sites in 2 counties, Stanislaus and San Joaquin counties, and has done so via remote data collection. And so it's either self-administered by a key staff or volunteer in the food pantry, or Kim conducts it over the phone, basically, goes through the assessment with an individual, having shared the assessment with the individual beforehand. And so for those of you who are familiar with NEFPAT, we're using NEFPAT. It has these 6 objectives, but we added this and created this objective, the challenges of the pandemic, to also collect data on these different pieces. And so the different areas that we're collecting data on are the different distribution modes, expanded donation options. So what other types of services are being provided by food pantries that are that they weren't basically engaging in or providing before. So at the organizational level, capacity and personnel changes, potentially new partnerships, and also crisis pandemic related challenges. And then while most of these are more survey format similar to the other objectives of NEFPAT, we also have an open-ended area or part where the pantries are providing what their main challenges and their main successes are to date. And we came up with the different sub-objectives, and the different options based on a rapid review of emerging gray literature, reports, and also newspaper articles, particularly those that reported from the San Joaquin Valley. And as part of the Care Innovation Fellowship, Kim had access to the care programs, emergency distribution sites, which are offered along the border and in other countries. And so she was able to also, through conversation, ask them about some of the changes that they've experienced during the pandemic to inform the development of this objective. And so just to give you a sense of some of the challenges that we had as options that they could tick off, not the open-ended piece, increased demand. There are some COVID-19 related pieces. So is it, difficult implementing COVID-19 precautions, economic and resource challenges, including supply chain shifts, and then nutrition education and the availability of fresh fruits and vegetables. And so this is a very preliminary results. Basically, the classifications of the 7 sites so far, 71%, or 5 of them are silver, the middle category, and then 2 of them are bronze, but none are at this gold standard. And we don't have information on what they were before the pandemic. So this is one of the limitations. We're only collecting assessing the nutrition environment during the pandemic, but based on the 6 objectives of NEPAT, we think this can be really useful. And we're going to start also differentiating by type. So something we're seeing is, the one church that's one of the sites that has a food pantry is in the bronze level, and they're experiencing a lot of different issues and less of a prioritization on providing nutritious food as opposed to meeting the demand for food in general. And so these are some of the things we want to explore more fully and in more detail. And these are the main challenges we found so far with the 7 sites. So the key challenges that have occurred is the decrease in personnel, particularly volunteers. In some cases, a loss of younger volunteers with age restrictions and who can volunteer in a food pantry. This, increased demand in the number of clients that are being served. And then the lack of cold storage has also emerged, lack of refrigeration or ability to store. And particularly over the summer, the 2 sites that were recruited over the summer mentioning that refrigerators had run out from their community. They couldn't even purchase them with the money that was donated because they weren't available. So they couldn't actually store any fresh fruits and vegetables that were donated during that time. And then the last piece is not having limited or no funding for this increased demand and not knowing exactly who to go for. So these have emerged as the main challenges just with the 7 sites. We're hoping to recruit at least another 7 to 8 more before we get into more detailed analyses. And then I am looking at the time. So these are 3 other things that I'm engaged in right now that I've kind of put on hold, but have been able to, my team has been able to keep going. The first one is development of the state obesity policy database. We're going to have 20 years worth of obesity legislation that was introduced in California. We're in the process of developing this database. And then the second piece, I'm partnering with Karina Diaz-Rios, who's our cooperative extension services person at UC Merced and a wonderful collaborator on the Global Food Initiative, which is what connected me with Dr. Ritchie to begin with. And we have a commentary under review right now that hopefully will see the light of day soon on the structural barriers influencing food insecurity, malnutrition, and health among Latinas specifically during the pandemic, not only in the San Joaquin Valley. That points to some of the labor market changes. So Latinas are the group that has been most affected by unemployment and sustained unemployment during this period. And so that's something we wrote a commentary about a couple months ago and are in the process, hopefully, of getting it out somewhere to talk about some of these issues, and that has more recommendations around SNAP, the nutrition care process, and also community initiatives. And then the last piece, this is another study on telemedicine in FQHCs, or federally qualified health clinics, and we do have a small piece that focuses on the provision of food services in safety net settings during this time. So clinics offering and now shifting and previously not offering nutrition assistance directly, so like food bags, but now they're doing so as well, and what their experience has been as it relates to this period. And with that, I see I have just a couple minutes for questions. So that's the end of my presentation. And I just really thank you for the opportunity. And sorry that I go really quickly. That's kind of my style.
Amazing, Denise. Thank you so much. You have given us so much to think about. I'm so impressed with all that you are accomplishing in a short amount of time.
A little better now, Dr. Ritchie, that my child is back in daycare. She was at home for 4 of these months. So.
Oh, my Lord.
Yeah.
so lucky to have adult children. Yeah, I think I shared this with you, but if I didn't, let me repeat it. That we're doing interviews, Veron, Nikki on this call, on this, yeah, I think that's, and Marissa's involved in that too, with 180 WIC participants. So it's a little different. We don't ask about their immigration status, and they're all women with young children, or it's possible that a few are pregnant, but without young children. I think they all have young children. Anyways, one of the things that they're telling us that you might want to add to your structured interviews is about physical activity. You know, they have little children and they're home with them, and most of them can't go to childcare or school, just like the rest of us. And they're just, oh, that was one of the main themes we heard about from them. We asked them more questions about their participant experience with WIC, so it wasn't as broad as your interviews about their, you know, how they're coping with WIC in general. But anyway, something for you to think about, because that was just a resounding theme.
So is this a disruption in physical activity or increase to physical activity because of their children?
Big disruption. So
yeah.
They're not able to go out. They were not going to parks, not going outside. Yeah. The kids weren't in school and childcare having recess.
So we're starting to hear about concerns about children, particularly from mothers, and the lack of physical activity and increased sedentary behavior, and even anxiety related to just being on the screen all the time, and how they're responding in tantrums and these others. And these are older children. I don't think we have young children and that have been reported in terms of ages, but we are hearing that, and disruption in physical activity behaviors, and even kind of the stress relief. I used to just go for a walk kind of comment, and I can't do that anymore. Because I might see a neighbor who will come close to me and doesn't understand we have to kind of be distant. Right. So there's also these like anxieties around maintaining COVID-19 standards with what they assume is like normal socialization in their circle. That's really interesting. We debated including physical activity because of the length, and I think I might bring it up again because it's so critical to obesity, but also to stress and these pieces.
Right.
I just want to do a time check that it is almost 1. So if people need to drop off, please feel free to. And Dr. Payán, if other people have questions, would you be able to stay on for a few more minutes?
Sure. And I'll also send you the slides, which have some links to share with the group. And people can email me if they're interested in any further information, but I have to drop off. But I can stay on for another 5-10 minutes if there are questions or people who have.
Great. Any other questions?
This is Susana. I mostly have a comment, I think, and about the association between food security and obesity. I'm in the process of analyzing data from farm workers specifically. They are all Latinos, and I was so excited to look into this link and found that there was no an association, and I was very surprised. But what has been what I found was that it's actually depression, which is the one that is consistently associated with food insecurity, because we have another round after 2 years and we measure again, and I find the same association, depression as a very strongly related to food insecurity, and it makes sense, right? Yeah. Based on the chronic stress related to the struggles that you already have mentioned. So I'm glad that you are measuring depression, and I was going to ask you, what are you using to measure depression? Because then, although your study is not focused on farm workers, it's so also hard to decide how you can measure these properly.
Right. So I'd be interested if what the percentage or number of females you have in your sample, because I mean, one of the things we're finding is all farm workers, those are the males in our group, as opposed to females who even who are less represented in the like farm workers sometimes.
Mm-hmm. We do have we have about half of them are females.
Oh, actually. Okay. Did you look at that only for females then? Or
The food security and obesity, yes, it was only females in one, and I didn't
For the
find
analysis.
association. But,
okay. For another study where we're looking at this association, we've used different measures. So we categorize by, you know, to normal, overweight, and obese status, but we also just looked at BMI. So and so then we also looked at I don't know if you have other indicators that you're also collecting.
we have a
So
lot
we
of
use that waist circumference.
Yeah, also waist circumference.
Okay, and then part of it, if your sample is also engaged in more physical activity, I don't know that there's work only with farm workers on this relationship. I've seen work and reviewed work on like population level surveys or CHIS. Those have been some of the studies that have found this relationship. And one of the studies that found this relationship, breaking up, you know, Latinos being so heterogeneous, so Mexican American women, but not other other groups. And so I wonder if physical activity and what the individuals, their, you know, kind of that might be one of the factors as well, or protective factors as part of their work. But to answer your question around depression, Sidra chose, there's 2 depression questions from a validated scale. I think it's 6 or 7 questions on psychological distress, and it has 2 pieces on depression, and they've also been validated in Spanish. So all of that study is also conducted, most of them have been in Spanish. And so we needed validated modules for English and Spanish speakers, but I can send it to you if that would be helpful. And one of the things we're exploring now is actually individuals who didn't, based on the survey questions, like you wouldn't categorize them as depressed, but then in the qualitative data, really, there's indicators of depression, including loss of appetite, increase kind of like not, you know, the desire to not get up, or other kind of indicators in the qualitative data, which a study I had conducted in the Dominican Republic was similar. We didn't have validated measures of depression in the survey piece for that study, but we found indicators of depression, but individuals who were not willing to say that they were depressed because of different reasons and what that meant even culturally. But there were indicators of depression. So one of the things Sindra is interested in studying or pushing and thinking about is, you know, do current validated measures of depression, are they capturing actual depression for different cultures? Because they may not, you know, be categorized as depressed, but they're revealing, and there are other indicators, including some cases we have quite a few participants who are going to the ER for severe headaches, migraines, and other types of things that may be related to excess stress and tension, but they're not coming out based on the survey results as being depressed. So that might be something to further explore, and I can send you the indicators that we have if that would be helpful.
Yeah, sure. Thank you. I might reach out to you with more comments and questions by email.
Sure.
Yeah, thanks.
Yes, please do, and just remind me so I can send that. But very nice to connect with you, Susanna.
Likewise. Thank you.
Hey, Denise, that was super interesting. Thank you for that great presentation. And just following up on some of the things Lorene had mentioned in her comments, I've been working on the WIC study with her, and I've been conducting interviews in Spanish. And you know, just I think you might be looking at some of these things, but there was kind of a surprising lack of knowledge about a lot of programs, safety net type programs, including food banks even.
Yep.
You know, so, you know, that EBT, rent protection, eviction protection, things like that. So, you know, just would be really interesting to get more information.
That's one of the clear findings is, so we have a little bit of a few probes about like the sources, if they were aware of these programs, like the sources of information. And so many people are relying in our sample on their social networks, which already, the entire network seemed to be excluded, right? And these actually, one of the limitations and caveats is that these individuals were recorded or recruited through community-based organizations, advocacy groups, and county and social services. And still, even then, right, they actually aren't representative in many ways of people who are really excluded and separate and isolated. And even then, they just have a lack of information about the programs themselves, where they would get information, And then we're not collecting self-efficacy. I wish that was something I'm thinking about, kind of self-efficacy pieces related to government assistance more specifically, but also charitable food sources. We are finding churches as one of them, which I had in previous studies in South Los Angeles, that being really important to individuals where they seek and obtain information about social services. But still, a lot of people don't have information about policy, pandemic-related policy changes, much less the policies themselves. And I didn't present that here, but public charge is just such a big issue this year, and confusion about public charge and what that means for individuals, and their fear and not being willing to put their name out there, or thinking that they're not eligible and their entire family is not eligible because of mixed status household composition. And so I didn't present that here, but that's such a big issue.
Huge. And then, a couple of the other things that came up to me, which are kind of more just kind of things to think about, is, some of the women that I've been speaking with, kind of now that they're getting school meals, which again are probably different from what schools normally serve, kind of realized how poor the quality of the school food is. And it's kind of interesting that in a paradoxical way, their kids may actually be eating healthier now. And I'm just kind of wondering, like, how that will impact them moving forward when kids do go back to school, and thoughts about, getting school meals again. Just a thought, something that would be interesting to think about. And the other thing too, just related to depression, is I've also just been wondering, like, about stress eating and, the extent to which that's been happening. Again, just a thought. And then finally, I'm sure you'll be this in your upcoming interviews, but, seasonal unemployment among farm workers is such a stressor always, and now combined with the pandemic and wildfires and
So those last two pieces are in the commentary manuscript that we wrote, exactly that. And I don't know if you're aware of Lopez Cepedo's work. She just came out with a study a couple of weeks ago on the role of emotional eating. This was pre-pandemic with Latinas specifically, and that actually the relationship between food insecurity and obesity disappeared when they controlled for emotional eating. And so that being a really critical piece to look at. And that was one of the types of kind of eating, what spurs on snacking. We can't, I wish we could do like food journals or more detailed kind of assessments, but also reducing respondent burden has been critical. But I did include some questions around, what prompts you when you are snacking to think back on that experience in the January and February interviews that we're going to conduct, to try to get a sense of emotional or binge eating and kind of the triggers.
Thank you.
But yeah, thanks for sharing that about the Wiki interviews. That sounds really fascinating about the potential changes and becoming aware of what is being fed in the schools now, because it's at home, it's coming home.
Well, thank you so much, Dr. Payán. I feel like we've all learned so much, and would it be okay if anyone else had questions to go ahead and email you at the email on the screen?
Yes, of course. It's really great to learn more about the work, current studies that are happening. Really look forward to seeing some of this work come out. Because it's the policy piece is very near and dear to my heart. We need this type of research to support policy changes that are happening in the next couple of months. So I love that Nutrition Policy Institute is doing that. Produces very policy and timely relevant type of work. But it's a pleasure to be here. Happy to connect with people via email. Sorry for going over a little bit. I hope at least some of this was helpful or useful in your thinking as you do the wonderful work that you do. So thank you, Merced. Thank you, Dr. Ritchie. Really appreciate the opportunity.
So helpful, Denise.
Thank you, Denise.
Can't wait to hear your full findings. Thank you so much.
Sure. Okay. Bye, everyone. Have a great day.
You too.
Thank you. Bye.